All right, hello and welcome everyone to the webinar. Just a few notes about today's format. The presentation will be about an hour and then we'll have time for questions. You can type your questions into the Q&A box and that's below at the bottom of your screen. And it is my pleasure to introduce Dr. Ace Gorig to you. He is a diplomat of the American Board of Endodontics and a life member of the AAE. He practices 90 days a year and is in the top 1% nationwide in practice profitability. He is a leader in developing endo-specific systems and strategies. He started Endo Mastery nearly 25 years ago to help other endodontists become personally and financially free. He's worked with and coached over 20% of all endodontics in the United States and Canada. And most of all, Ace loves the endodontic profession, his patients, teams, and his referrers. So without further ado, Dr. Ace Gorig.
Great. Welcome, everybody. I'm very excited about being here today. It has been quite a ride for us. As I was looking at, let's see if we can go ahead and I'll move these slides forward here. Hang on one second. We'll get this rolling here. Okay, so far this year, we were very excited about the new year. We were in our office, usually we see somewhere between a 15 to 20% increase each year in our production. We get more referrals, we're getting a little more efficient at what we do and thinking about bringing in another associate in our office. And so we were looking at this to be our best year ever. The only problem is this pandemic came. And it's sort of like a gigantic tsunami that's just kind of it's coming over this country. And it's really how we respond to this tsunami. And I look at it a little bit different. I mean, I've always felt that there's always a great gift in every disaster. And so instead of fear of the tsunami, crushing us, we might as well just have some fun and surf it all the way to the end, shall we? And so today, what I want to talk about is things that I have learned by staying open in practice, by working with maybe 50 to 60 of our Mastery Circle members who have been through my coaching program and other coaching individuals we're working with to share ideas. And it's just amazing how everyone has done when we have a great approach. But today what I want to do is share the things I've learned during these weekly meetings with each of them, and then give some ideas for resolution so that this tsunami actually becomes a great ride instead of a disaster. But where do we stand today? Really, about 80% of all endodontics offices have remained open. Some only a little bit, seeing 1 or 2 patients a day. Some of our people are actually completing 10 cases a day. It all depends on your approach and how you look at things. And these are basically true emergencies. We really haven't really done emergency treatment that we're not, emergency. Of course, anytime a doctor calls you and says it's emergency, it probably is. But during that time, we've saved patients from hospital ERs. We've, like I said, done only emergency care. But initially, when we first started, the first thing we did, realizing that, instead of putting our paying for our people when they're not working, we put them on unemployment. And we'll talk about that. And then with the new PPP loans, we've kind of brought them back. We'll talk about how we go about doing that. Most endodontists out there have seen about a 75% reduction in their patient flow and revenues. And I think in the teams we've coached has been probably have seen maybe a 50% or 40% decrease in revenues. Referring doctors are going to be opening soon. Actually, this week in Washington, they have been opening, but they're in a bigger hole than we are. First of all, they have only maybe seen a couple emergencies, which they've referred over to our office. So basically for the past 2 months, they really have not had an income. Not are really prepared to kind of get back there. They don't have all the PPE equipment that's necessary. And what I have done is actually I've been kind of stocking up so that I can share with them, you know, level 3 masks, shields. I've been buying a lot of shields so that I can share with our referring doctors and things that they need, like gowns and stuff that they're not prepared for. I've had quite a few come over to my office, and I've given them things that we've had set up for them. And they will initially send out more endo because they do have a pinned up demand already from patients they have. But eventually they will run through this pinned up demand. And what I'm getting from the general dentist that I'm working with is about half of their patients want to come in, the other half are fearful and are just pushing off treatment. And there's different reasons for that, but we'll talk about that. More patients, for example, and team members are apprehensive and actually fearful about about coming back. They're nervous about the virus, avoiding non-essential expenses, the patients. Many have lost their dental insurance, their patients also. And this acts kind of a scarcity mindset with our referrals. Will there be enough? And so eventually we may see them actually going back and trying their own endodontics when things are slow. And I can definitely see that happening. And like the last recession of 13% downturn in the dental was because of the economy. But in this case, we have an additional fear factor that we have to worry about. And there is record unemployment that will probably persist for a while anyway. And also their employee benefits are going to be reduced. So we have to be concerned about that. But if we have a game plan, and if we're doing things right, we can win back our referrals. We can put our patients to ease, and we actually can ride this wave successfully. And that's what we'll actually talk about. So, okay, so the survey, we're going to talk about economics for a minute here. And let me just modify one thing here. So anyway, we did a survey of the people that are on the call, and what we found was that really only about 5% or less than 20% in drop in what they've been producing. And maybe another 10% are between 20 and 40%, but the majority, including as much as 80%, which is probably at least a quarter of this, and are somewhere between 60 and 80% or 40 to 60% drop in their production. And that is just by seeing emergencies. And we early started to do things when the offices were shut down, for example, like, calling all referring doctors, letting them know that we're open, going to the emergency rooms, letting them know that we'll take patients that have real toothaches, and done things like that to increase the productivity while we were in the office. Another part of the survey we looked at, and we'll discuss a little later, is that how many people were able to get the PPP loan. And the people, about 75% responded that they were able to get the loan, and that was great. A few percent, maybe 5%, applied but did not get the loan. I think the big problem is they should have gone to smaller banks instead of the bigger banks, but some did not apply for the loan at all. And for those that did not apply for the loan, I want you to be able to talk to your CPA about getting tax credits, because if you didn't get a PPP loan, there are a lot of great tax credits that you'll be able to get at the end of the year, and I want you to think about that. But during that same time frame, we talked about productivity. So far, the average is, since the beginning of the shutdown, about $95,000 has been lost in revenue. And of course, not only revenue, you still have your expenses. Yeah, and that's basically looking at this group that are on tonight. But what is normal? Is this going to be a new normal? If we reopen, will this lead to resurgence in the virus in the future? That's a concern people have. Will we get a vaccine that's available nationwide? Is this coronavirus, will it be an epidemic or just like a seasonal flu, such as the last coronavirus that they've had? Actually, we've had quite a few of them in the past years. If the infection control procedures can ever be the same as before, we're going to talk about that, but the real important thing to get to is actually what we have done in the past is pretty much what we need to do now. Expanding this is really more for the perception of the patient, and in reality is, I don't know if it will add any more benefit to safety in our offices. If scheduling and practice procedures can ever be the same as before, and we're going to talk about that. So we have immediate challenges. The first challenge is bringing back the team full time, and then qualifying for the forgiveness of the PPP loan. And we're going to talk about what we need to do to get that done. And of course, the next one is infectious control. Do we have enough PPE? Are we minimizing risk and transmission in our office? And when we do get back, and as we get busier, we need to kind of role play a little bit about whose job is, do they need to, what do they need to do to make this a smooth transition of bringing our patients in during this time. And we have to also address the mindset and fear of the patient. And really, it's perceptions become reality, and it's how do we transmit that safety to these patients? And we will address those issues also. The big picture challenge is staying connected with our referrals. I know a lot of you have texted and called your better referrals. We've sent out emails routinely to all our referrals, letting those different sources to get their PPE, giving them ideas on how to protect their patients and during the practice, and exactly how we bring our patients in, which I'm going to also discuss with you today. And oh, by the way, if you see some things that we can do better in this presentation, whether I would appreciate a call or even a shout out in the comments that you can throw in there to add and share with everybody else, because this is what we do this for, is really to share our ideas. Now, how do endodontic practice can recover quickly? That's our big thing. We need to maximize productivity in closing the gaps. Initially, when we first opened our office, we kind of put a space in between, so there's only one patient at the coming in at a time. And then, we found that in reality, we had a lot of free time in between. And so basically what we did was just go back to the way we booked before, and then bring patients in. We would bring them in and really not have them in the reception area, but basically bring them back to the chair to fill out forms. And we'll talk about that also. And then we have to have a recovery strategy. And I'm going to try to share some of the ideas to help you come back and actually be as productive as you were as quickly as you can be. So bringing back the team and navigating through this forgiveness loan. And, the real question is, how and when do we bring back employees? Most of you have had them on part-time. And now that the real simple answer is you bring back as many people as you need to bring back. Now, just to let you know how we looked at it, and many of the Mastery Circle members, we talked about that. Initially, like I said, we put them on unemployment. And then in my office, there were a lot of my senior people were making, it depends on the state, but our state's pretty good. Their weekly pay from the state was like $700 a week, plus the extra $600 a week. I did have younger employees that were not working that long in my office and did not get as much unemployment. So I used the junior team members to work actually full time, and put the senior people on unemployment so they can maximize their benefits, and that the junior employees could actually get a full salary because they weren't getting that much on unemployment. Now that we're back and we're going to bring people back and put them on the using the PPP loan, then I've actually put everybody back to work, except they're working like maybe 25 to 30 hours a week. And we'll discuss that also. So the doctor's perspective, this to handle this answer, it's, we all feel an obligation to take care of our team. I felt, like I said, the best way to take care of our team is put them on unemployment so they can actually make good money. Now, the problem is in certain states like California and Arizona, the maximum they get is like $240 a week compared to our 7. Added to the 600, it does help. So they're more anxious to kind of get back to work than other people that are getting actually paid better than they did on working in the office. I don't know when the practice will really be opening back to full schedule, and we don't know that either. And that's one of the things we have to concern ourselves with. And if I have the PP loan, which requires me to bring the team back, we should use it, and I think we should use it as we bring our people back. Even if I bring them back, I don't have enough for them to do, and these are the main concerns that we have. But in reality, what we can do is bring them back part-time, like we said. We also have available different sources on learning, like infectious control, different videos on that. We also can go to Endo on Demand and have them observe different videos while they're at home to meet some of that requirement, or they can just have more time off. But we want to have as many people in the office that makes the office work. We don't want to be understaffed or overstaffed. And it really depends on how many patients we're getting during the day. Now, the team perspective, of course, is that some of these, team members, they know they're doing just as well on unemployment and may not want to come back. But, you can, if they're not coming back, then basically, you basically lose out on the money, which is not bad, just money you haven't had anyway, and you would be giving it to them anyway. So it may not be that big of a thing. And some patients, some of our team members, have difficulty coming back because they have already planned to, have their dependents at home because they're teaching them grade school or high school or whatever, and so that's another issue we're concerned about. And then on the other hand, they just don't want to come back because they don't feel safe. And I do believe there will be a few people like that, but there will be great opportunities to hire new people for those people that don't do that. So let's look at the strategy for our PP loan. Basically, what it does is once we get the money from the bank, it goes right in our bank account. Now, we don't have to spread it out over the 8-week period initially, but we need to spend it over an 8-week period as soon as we get it. So whenever you got it, I got mine May 1st, and so really near the end of June, I have to spend the money that was given to me. And then it's important to keep good record keeping. We all know that. And some people have recommended maybe opening another bank account and putting the money there. I talked to my CPA, and she felt it was probably a little bit too much work to do that. And in addition, it would be pretty simple just to categorize the expenses on your QuickBooks. And basically your bookkeeper or your CPA can do that for you. And it's pretty simple. It's just, how many expenses do we have? We have our payroll expenses. Those are easily calculated. We also have their healthcare, which is easily calculated. And actually, we've created a little calculation Excel sheet that we're going to share with you that you can keep track of all these things. And then to forgive the loan, you have to do a few things. Number one, 75% must be spent on payroll, and 25% is on other eligible costs, such as rent, utilities, and things like that. You must provide, the individual salary must be at least 75% of pre-pandemic time. You can't reduce it more than 25%. So that's just another rule. And the grace period goes until June 30th. So you must bring back 100% of your full-time headcount. So if January, your full-time headcount was 8 employees, including yourself, I guess, then you have to have 8 employees. And that's by the last week. That doesn't mean you have to hire them now. I mean, you might have 5 employees now, but before the end of June, you have to be paying at least 8 people in your headcount to get the full grace. I mean, the full amount of forgiveness. If you don't, then there's a reduced amount, but you will get some forgiveness. And that is compared to the 2 dates. You can either consider the 1st of January to 29th of February, the head count there, or the year before, and take which one best works with you. But you know you're going to work with your banker on this anyway. But here are some considerations. Number one, this is free money. It's okay. You're allowed to keep it. We'll help you make up for the losses that you had during the downtime. And actually, your rent will be covered, and also your payroll, which are your biggest expenses. Now, any unspent funds can be returned, or you can just keep it as a loan where you continue to have it for the amount of at 1%, interest rate, which is not much, but I would basically just return any funds that were not forgiven. Your full-time employees don't have to be the same people. Some people just may say, I just don't feel comfortable coming back and I choose not to come back. Or some people you may let go because they're not great employees also. And you can bring other people back. You may even bring family members back that are eligible to work and put them on your payroll and start paying them. The head count number is reduced by for full-time employees for any of your team members that refuse to come back to work. Like some people say, I'm not coming back. It is just too stressful and whatever. And you document that, and basically you show that this person refuses to come back. And if you had 8 employees, then really you only need 7 to meet the requirements. So that is another condition which is apparently happening with this loan. Remember, all these things can change, but right now that's where we're at. You can also just keep some people on unemployment. I mean, if you have a team member who really needs to be at home because their child's at home, and you don't really need them at work, and you can bring them back at the last week or 2 and take them off unemployment, that's great. You could do that and still meet the requirements and allow them to have full unemployment during that time. So that's an option you have. And also when you are paying people back, paying them part-time, because when you do come back, you can keep them on part-time or reduced hours. And like I'm doing in my practice. But I can also say, well, I'd like you to watch this video on infectious control. I would like you to watch some videos for team members from Endo on Demand, and you can check, or you may want to work together and watch certain videos. And I have 1 or 2 videos I'm going to recommend that you all watch together to make them feel good about the safety in your practice. And when you the reason we take members off unemployment and put them and use the PPP loan money is because once we start paying them their full salary, and I bring them back, including what they would have gotten in bonus, I pay them the full salary, just like I look back in January, saw what I paid them. And now once they're off unemployment, they are able to save this unemployment for further use. For example, if I kept them on part-time unemployment, they'd be losing those weeks of unemployment. And they may only have 13 weeks, although that has been extended in our state. Each state's a little different. But as soon as I bring them off unemployment, I've saved them 8 weeks of unemployment that they can use later if it does get slower in our practice. And another consideration is that when these doctors come back, these general or referring doctors, they may want to work as many days as they can just to catch up. If they're working 4 days before, they may work 5. They may even work weekends on a Saturday just to be able to try to catch up all the money they lost during these last 2 months. We need to be open, whether you're there personally but you definitely have to have the office open and be able to come in to handle any emergencies or other endodontic requests that they have. So those are consideration. But remember, when we're looking at the small businesses, association, they can change the rules anytime, and so can the state unemployment rules change. And so we're kind of at their whim. There's been some push to be able to reduce the amount of money going to payroll, to reduce it 50-50 instead. But we'll see how that all comes out over the next few weeks. This is an example of the loan forgiveness calculator that we'll send out to you. It shows this was the initial amount of loan, and basically what you need to do is just put in the salary, wages, health benefits, retirement, and this will add up here automatically. The same with the rent, how much we're spending on utilities, gas, water, and things like this. This will all add up here. And any eligible interest on prior debt, you can put that down here. And this can tell you what percentage that you're using up if it meets the requirements, so that you're above the 75% for payroll. So it's just a little gadget that I wanted to share with you that we put together. Okay, let's look at the team. If they don't want to return, I would recommend hiring a replacement, and I would do that as soon as possible, as soon as I needed them. But definitely you want to be up to full capacity before the end of June. And some states require that you report that a person has decided not to come back to work. Now, sometimes they may not come back to work because they're making that extra $600, but you might have to remind them that that stops on July 31st, as far as that money being available for them to use. If they aren't a good fit for your practice, this is a great time to free up their future. I mean, gee, they've got great unemployment. They have the extra $600. It kind of puts them out there, and it's really a benefit to them and to you. You really should not need to keep any substandard employee that cannot grow up to be an A employee. When I go through different offices, I have the doctors grade their employees from A through C, and any C's, we just say, no, we need to find someone else. And it has to be a B or an A before we really recommend they keep that employee. But this will be a great time. There will be a lot of people out there right now that will be put off from working or just quitting other offices. And so I think it'll be a great time to hire. What we want to do is create a safe, productive, and very financially sound environment in our practice. And this will actually give us an opportunity to do that. Okay, let's look at the resources that we have. And so let's look at the mask situation. We of course need these PPE for, to reduce the risk of transmission for patients, our team, and the doctor. In basics, we eliminate symptomatic persons. First thing we do, basically through screening through the telephone, our first phone call. And it's amazing when patients come in, we sort of ask these same questions. It's amazing how many times they say positive to the things they said they weren't doing. Like, yes, my husband does have the virus, or something like that. So I would actually re-ask them again. And then also, we just need as many team members as it does to do the job. And we don't need to bring everyone back and stack them in there. I'd rather have them, sharing their hours and being paid full time. For example, if they're only working 30 hours, I'd pay them the 40 hours, just like they worked before. And then I'd share the duties so everyone gets an equal shot at it. Reality of asymptomatic transmission, which means, we have to treat everyone just like as if they were infected. And it's going to be interesting. And I wanted to share a few things that's really important to show you how safe we are in the dental office and how we need to really make our team members feel safe. Some of the protective equipment we've talked about. We all need masks, face shields, gloves, gowns. Where do we get them? Here's an example of one office that I put up a glass, plexiglass that can be removed, actually, protection for when they come up, and kind of a line to stand behind until they're brought up. And this is my office. I love this TV here. During the winter, we have fireplace scenes, and here we can either have mountain or river scenes or things like this. But we did move away these other chairs because most of the time no one's sitting out here right now during this time. But we've moved in our plastic chairs, which are a lot easier to clean. And you can see our people wearing masks, or at least when patients are around, they're wearing masks up front. And when they come back, they come in here from the front door, and the dental assistant will see them. They will come out, greet the patient, bring them back here, and back here they'll take their temperature, and from there they go right back to the operatory. This is a device. It's called the Air Doctor Pro. I think it was on sale for like $360, but it basically filters the air, and it has a HEPA filter in for around 2,000 square feet. So actually we have one out here and we have two in the back. And I think it's important to have it there just for patient perception. If it really makes a difference, who knows? But at least we're doing things that makes people feel comfortable about coming to the office. Now, you notice how this door is locked open. That way we don't have to hold the handle, wash down the handle, and whatever. As we come in here, we have protection for the team. Remember, it's mostly droplets that affect, and that's mostly from talking or coughing versus the spray. And so we have some protection here. We also have a hand sanitizer, and here we give the patient a mask, and actually we bring them back and do the treatment in the back. So let's look at some ideas. And this is probably one of the most important things you'll probably get during this presentation, is when they compared N95 masks with level 3 masks. There's level 1, level 2, and level 3. Level 3 is much more comfortable. When they compared that in different studies with the flu influenza, they found there was no difference in outbreaks of flu between those that had the N95 or the level 3 mask. And there have been other studies in addition to that. And I'll have some other information that I can share about these masks. The big thing about the N95, there are problems with that mask. I knew a lot of people who went and got these masks. They were able to get $5, and what they were KN95 masks, and a majority of them were defective. I mean, they weren't even usable. And the real N95s, if you look at them, are really overpriced. But if you look at the filtration for contravirus, it is equal as far as and there are ways to adjust these masks to fit close to your face, and when I will give you a little video clip to show you how to do that. The N95s are more difficult to breathe. Anyone that's had one, I've had one. My partner, he says, I can't wear this for more than an hour or two. And you looked at his face, and it was basically, he was starting to get a rash. And I've seen so many of our doctors that are using these that have that problem. And so, if you can use a level 3, at least for your team, and face shields, they're equally effective. And so I would have some N95 to say I have them, but in reality, if you look at the research, they're pretty much equal, okay? And we'll give you a list of our on the information on that. This was a great program. It was on May 12th. It was by Dr. Markus Troelisch. He's German. He's a German dentist. And he's a MD and a DMD, a surgeon type. And he was talking about Germany. And in Germany, all the dentists continued to work. And if you go to, we'll give you the link to the video, but this is a great video for your team actually to listen to, I think. His program starts around in 14 minutes, and it goes, they have question and answer, but I mean, it's probably about a 45-minute video. And he talks about a lot of things. Some of the key things he talks about were that droplets, not the aerosol, is where transmission of infection is greatest. And so we all know that we create an aerosol, but more concerning is someone coughing or talking loudly, and those droplets are the things that are most concerning. And of course, we have a rubber dam, which helps a lot. And then he also demonstrated how his high-speed evacuation system, like we all have, was highly effective at removing these droplets and aerosol when we're working. And this, in addition to the rubber dam, is very, it basically clears all these out of the way. And we really don't really need to be concerned as much as we're making this, I think. And he also believes that a level 3 surgical mask work much better than an N95. He will use an N95 when he's working on a COVID plus a management case where someone has the virus, and he does treat them, but then he will use this and a shield and feels very comfortable doing that. He also mentioned that the 94,000 German dentists have remained open through this whole process. They've been considered essential, and they do routine care, including cleanings and things like that. And yet, since the pandemic began, there have been no cases of COVID cases between any of the doctors or team members related to being working in the office. I think that's a very important thing to remember. And also, if we look at, we just need to treat patients just like we've always done, and that was his point. And I think if we do that, I think these other things we're doing, I think they're good for a while. I think having HEPA filters, I think bringing patients back, asking those questions, this is just to help with our perception with our patients. And so far this year, I have not heard of any COVID cases coming from working in a dental office that has been reported. I can guarantee you, if a dentist or a team member got COVID and they say they got it in their office, it would make news. And yet we have not heard of anything, although we've heard of physicians getting COVID in their workplace. And that has also been true. I think he also mentions that he had a friend, a dentist friend in Wuhan, and he said that the dentists, which were always masked and always gloved and wore gowns anyway, rarely ever got the disease, while many physicians did, because we've always been a little safer than physicians. And if you really look at the death rate, let's look at the 2017-18 season flu. 48.8 million Americans were getting sick from the influenza. 27 million went to healthcare providers. About 1 million were hospitalized, and there were about 79,400 deaths during that year just with the flu. And during that year, I think we all just treated patients as normal. Matter of fact, I've never really ever gotten the flu, and I've been in dentistry for about 50 years, actually more than 50. And in those days, we never wore masks or gloves or any of this stuff. But I think we're fairly safe. And that's the main point that I want to bring out, and that's what he was bringing out and wanted to share with dentists in this country. There are a lot of face shields out there. We'll send you links. Well, for those that have loops and work through different face shields, and also for your patients. I mean, this is one on the right here is like a $3 face shield. There are different face shields out there. You'll look at them as we share more and more, and where people are back to work, we'll find out what makes people feel happier. This was a great picture from Bjorn Johnson in California. He created this shield for his microscope. And so basically everything, any spray or whatever kind of goes through this up around here. And he says it really works well. He has given me the design and how to do that. For those that are interested, we'll just basically send you out a link to show you if you'd like to make that for your scope. I think it's probably not a bad idea. This is an interesting case of the use of a face shield to turn it upside down, which actually looks like it works pretty good. This is Mike Feldman, one of my good friends, and he's been with our coaching years for many years. And he said, you can see him with his N95 mask and with a level 1. That's what a lot of doctors are doing, and they just discard the level 1 mask. But I don't know if we really need to do that. I think we can use the level 3 even. It can be one-time use. They're a lot easier to get, but on the other hand, you could use them throughout the day if you want. But he was pointing to me these eyeglasses and protective shield that he got from Kerr, and fairly inexpensive, but he found them very effective looking through the microscope. And when you go to Kerr, you can see these face shields. They basically fit around here. And you buy the shields, you can hook them onto your little loops here, and he found them very effective working through the microscope with those. But just another idea. One thing that we were a little concerned about N95 masks, because I did not have any. And then one of my friends pointed out that you could go to emergency management, one of the people in my coaching program, and the county emergency management center, and you call them up. And we called them up, and they said, yeah, well, come on down. We'll give you 50 N95 masks. And that's what they gave us. And I had another friend of mine, actually, and also someone I work with in coaching, Brian Hornberger in California. And he went ahead and was able to get, I think, almost 100 N95 masks and level 3 masks from the emergency management. Other people have called me up when I've talked to them about this, and they've got gowns and other type of PPE for their practice. And all this is, of course, free, given out by the government. So if you're having trouble finding some of these things or having trouble getting them, instead of ordering them, go to the local emergency management in your county and call them up. Now, Brian, he called them up, but they really didn't respond. So he drove down there, and they said, oh, you got to go over here. He went over there. He says, you got to go over there. And on the third time, he got over there, and they gave him 100 masks. Interesting. Another thing is being recommended, and maybe for a short time, is the idea of hypochlorous acid, these foggers. Now, you can go on eBay and order this fogger here. It's around $250, and you might get it in June or July, okay, because that's how far they're back ordered. This fogger here, if you look at Office or Home Depot, they're $99, but fortunately I was able to go to eBay and get it for $360. You know, so I want to try all these things out, but actually it came very rapidly. So, and then you can order this way to make your own hypochlorous acid. Basically what it is water and table salt or kosher salt. And you put it in there, and it creates a type of chemical with water and salt water. And you load it up, and maybe once a day you kind of fog the rooms, which eliminates a lot of people use this on airplanes. They use them on city transportation to defog. They're very safe and whatever. It is a thing that you can say you can use, and I would look it up and see how people use it. But on the other hand, it might be overkill. So just another thought for those that are interested in looking at foggers. This is the air doctor we talked about. It's some type of air purification, filtration for viruses. And also, some people are buying these UV lights to actually go over your N95 mask, which will kind of sterilize things or sterilize anything that you feel like you can't wash or down. And it may be useful, but I'm just throwing those things out, and I'd probably do your own research. I did buy one, but I just don't know if I really want to use it yet or not. Okay, so another concept. So let's talk about patients and our protocol and how we visit our office. You can do teledentistry, basically find out or consult over the phone. One great advantage of that is that if you can determine if it's treatment or non-treatment, although really you almost have to see the patient, I agree with that, then patients can be billed, but on the other hand, it just saves the side books. And that's the key, is reducing side books. That's what puts people behind, and that's what fills up the rooms. And what we really need is to teach, and that's one of the things in our programs that we do teach and our coaching is how to train your team to make sure that the only right patients come in. How do you train your team to know that this doctor always sends fractures? And they asked the patient, did the doctor mention the tooth was a fracture, which he probably did. So we put them on the side instead of bringing them in as a treatment. So it's really training your team to really listen and reduce the amount of side books and only put patients that need to be treated in treatment slots. And so when patients screen, when they're screened on the telephone, your team needs to know to ask them certain questions. And the best way to ask this is they say to the patient, well, the doctor wants me to ask you these following questions. Have you run a fever lately? Have you been sick? Are you with someone that has the virus? Have you been out of country? Those routine, but it's a lot better to say that than just say, well, our policy is we have to ask you this, okay? It's all about creating a relationship with the patient. Also, I recommend, we've just modified and updated our forms, and ours is fairly simple. If you ever go to our website, nwendo.com, and look at our basically true forms that were made by PBHS is the website that I use, and most of you may even use that web company. I think it's a great company. And so we have them fill out these things in form, and if they have a problem, we can kind of walk them through that because it saves time in our office to help them through that process. And then basically once the forms are there, they can sign them right there online, and then it's put into a folder where we can go and pull them out. And instead of having the patient come up and fill the forms up here, which does save us time in the chair. And once the patient arrives, they'll come in. We recommend that their companion stay in the car, and unless they need their companion for security or translation. I just had a lady that was from Russia and did not speak English, but her husband did, and he was in the room explaining things as we went along. And so we welcome at the door, usually by the assistants who's masked, gloved, and like I showed you in the picture before. We bring them up, hand sanitize, take their temperature. I have oximeter here because even though patients may not have a fever, they may have low oxygen level, which would be an indication of the virus. And it only takes a second to have them in there. We do that when we do basic conscious sedation. We always have their oxygen levels when we're working on them. And so it's an assessment for the COVID. Giving disposable mask at them there, and they can bring it back if they don't have their own mask. Sit them in the chair. They can sit out and they fill out the forms, and then they sign the registration forms, and and then we basically give them a pin to sign them if they haven't done them, and we let them keep the pin because it has our name on it. We give pins out all the time. In some offices, they're recommending that they rinse for about a minute with 1.5% hydrogen peroxide, which is like peroxol, which is commercially available, or you can make up your own. But that may help. Actually, we're really not doing that, but there's some offices that do that, and it definitely does reduce the chance of virus. We review the infection control precautions that need to be taken. And we show them these are the things that we're doing in our office to keep them safe. And then the assistant goes through the patient interview, takes the necessary x-rays, and then I'll come in and with my mask on and gown, but I usually put my gloves on in front of the patients to let them know this is the first time we've used gloves and it's there. And I do the diagnostic tests, and if treatment is needed, I anesthetize the patient, and I sit there with the patient. Now, before I used to transition, and sometimes I would go and usually get the anesthetic diagnosis and go back to the other patient, and I would go ahead and complete the cases. And what's interesting, what I have found is that if I just stay with the patient, I'm much more efficient than actually transitioning. And that's one thing I'd like you to look at. Now, the big deal is how long does it take for the anesthetic to take effect? In reality, what I've found is that about 2 minutes might be a little longer, and but I will go back in and either on the lower, especially the lower, if it was a vital case, I routinely do a Stabudent or a PDL injection. Now, when we're talking about PDL injection, I'm just basically saying the regular anesthetic syringe with a lidocaine 2% and just the 30 gauge needle. And what you do is you take that needle and you push it to the distal on the buccal and the lingual, and you push really hard. And I'll guarantee you that that patient's going to be numb, and it's going to be done immediately. Then you just can go ahead and do treatment. You place the rubber dam, and usually I like to have it higher so it kind of goes over the nose. And then we go ahead and treat the patient. Take our final x-rays, they do the post-ops, we sit the patient up. And we try, and my recommendation because really over these next few months, if the more multi-appointment endo, first of all, the patient doesn't want to come back. And sometimes once they're out of pain, they won't come back, and you're going to lose a tooth anyway. So I believe in multi-appointment endo. I've been doing this for 50 years. And we see the patient, we complete the treatment, and you'll have less postoperative pain. It's hard to understand. Very rarely is there a chance when I don't need to do everything in one appointment. But it's all up to you, whatever you feel comfortable, it's great. But ideally, I would try to do most cases in one appointment. Now, once the appointment is completed, the assistant will go up front and say, this is what we did. And at that time, even though we've already talked to the patient over the phone, told them what we expect and the charges, and they probably have a good idea, then the ladies at the front will calculate the fee, will bring it back, and the assistant will present it. This is your fee today. Will this be check, cash, or credit card? And they will give the money to the credit card to the assistant. It will be run off, brought back, and the patient will sign it. And then the assistant, after they process the credit card, will bring the patient actually right through the front door and right up to the front door and escort them out and just thank them for being such a great patient. And very little communication is done between the ladies at the front and I can see over time, that's why I got those plastic protectors for the front office, that we will eventually get back to allowing the the front actually to see the patients. But it's just another way to make your team feel more comfortable and in the treatment. So at all times, we tried to avoid patients crossing, paths. And the things that everything right now that patient touches, we try to sterilize or clean. But I don't know if it really makes a difference. And over time, I think we'll get back to the way we did, where we normally do our normal cleaning of things and like that, instead of scrubbing everything down like door handles and whatever. But initially, if this makes the patients feel better, if this makes the team members feel better, then I would continue to do that. Now, scheduling is a big deal, and it's amazing when I coach endodontists around the country. A lot of endodontists, I ask how many cases they do, and they'll say, well, I'm doing 5 or 6. In reality, when we look at the number of cases they treated in a year and the days they work, most endodontists are doing 3 to 4 cases a day in completions. And that's an important number because they're telling me that they can do a case an hour, and I do believe them. And most people say it would never take me more than an hour and a half to do a case. Well, if they did a case an hour, they should be doing 8 cases a day. Or an hour and a half, they should do 6 cases a day. Now, if they're doing 4 cases a day and you do 2 more cases a day, that means you have just increased your net profit by $500,000. I mean, and you told me you can do a case in an hour, and you're working 9 hours. So why aren't you doing 9 cases? And so that is the whole thing. And what happens is people just don't know how to schedule. And they put too many side books off the side. And so maybe emergency in the wrong place. And so the doctor is pushed and stressed behind. It's interesting, when I work with doctors, I ask, what is your stress level? Initially, it's like 8 out of 10. And then I ask, what's your exhaustion level? And usually 8 out of 10. These are doctors that are doing 3, 4, 5 cases a day. And when I get people to do 6, 7, or 8 cases a day, their stress level almost drops in half. And it's all about scheduling. It's basically limiting transitions. It is, making sure you have enough time to sterilize between the patients. But it's also the way we teach the people up front to schedule. And in this case, of course, we like to minimize people in the reception area, which is important during this time because of perception. Impact on productivity, scheduling is needed more than ever before. And if you're doing significant number of cases, just keep the same schedule. If you are doing less, cases, then you really need to look at your scheduling and get it fixed. And what throws a lot of people off are the side books. They take too long in side books. And if they have too many side books, and a lot of endodontists tell me they do, then teledentistry may be one approach, but also the idea of a power hour, where you might line up, 4 consults or evaluations in an hour, over 4 chairs, and or 3 chairs even, because you need 15 minutes in between to clean them. And so that's just another way of getting rid of side books. Now, we have to understand that patients are fearful. They're afraid of the COVID. 71% of patients polled were uncomfortable seeing the dentist, and only 54% felt comfortable visiting us for emergency care. And this is kind of crazy. And so we have to address their fear. And this is, we're going to talk about how we do that. But remember, patient's perception is reality. And we have to, so it's about basically communication. So how do we do this? Well, team members must feel comfortable first. So that's why you have to have an office where they feel safe. And that's why we have to talk to them about some of the things that we've discussed so far. We look at everything from the patient's mindsets. Don't treat patients if they come infected. We've already looked at that. And this is we have to remind the patient what we're doing safe. And I'm going to give you a list of what we actually hand out or we put on our website that shows things that we're doing to keep people safe during this time frame. We need to develop those great verbal skills, and we need to be able to practice and role play so the experience when they come in the office is seamless. Okay, and this needs initially to be rehearsed as we get busier and busier. It just should be really flow, like it's not awkward. You have to be here and there. And that's the time you need to sit down with your team and kind of go over things if you feel things aren't flowing like they should be. We have to tell the patient on the phone what we expect of them when they come in. We talked about the online forms. I'm going to kind of reiterate this stuff again. We talk about the arrival process. When you come in, this is what's going to happen. The companions can stay in the car for now. We welcome the door. There's no waiting. We minimize contacts with other people. And we have to remind our team at the front never to use the word policy. This is our policy. Instead, we want to remind them that everything we do is for their benefit. Okay. And so we're looking forward to seeing them. That's what we need to tell them. We're also saying, remember that if there's anything, there can be conflict. Remember, you always start off with, the doctor has asked me to do this. The doctor had asked me for you to fill out these forms. Okay. And there's less pushback when that happens. And then as I said, everything needs to be explained as a patient benefit and about why we have our new infectious control measures that we've been doing. Actually, we've been doing this for a long time. But we've added a few extra things for your safety. Okay, so this is kind of a list that we'll send you that we kind of pass out. And what were we doing to keep yourself safe? Well, we screen every patient before appointments. Non-patients are asked to stay in the car. We check your temperature of each team member and patient. And it kind of goes through the whole process of things that we do, how we every single week we run weekly spore strips on our sterilizers to make sure that they have the ability to kill the toughest organisms known to the medical science. We wipe things down, things like that. And also, initially, now some of you may be getting back to work like we are and where there are people at the front office. In the past, but some of you may still, your doctors may be still not able to come in. And what my team came to me and they said, well, gee, that doctor's angry at me because I told him we couldn't get him in today. And so we had to kind of rework our verbal skills with dentists. And so here's an example. Here's a referring doctor. He says, my patient has been in pain all night and I would like you to see them right away. And I think you've heard that, even though they come in, they say they're not in pain. And our verbal skills, Dr. Smith, thank you for calling our office. What's the patient's name, tooth number, and patient symptoms? Do you feel that the patient needs to be seen today? What is the best contact information for the patient? Now, we don't say, well, our practice, our day is filled today. We're not here today. We don't even address that. We just remind them we're going to take very good care of their patients and hopefully they don't ask if we can't see them today. We might be able to see them today, but the deal is we just don't give them an opportunity to have conflict. And then we say, well, Dr. Smith, I will give Nancy a call, your patient, and we will take care of her. Then you talk directly to the patient and see how soon the patient really needs to be seen and schedule them the way we need to schedule them. And there's also this little write-up that we'll send you that basically talks about these verbal skills. So you have those also. Now, I can't overstate the importance of staying connected during this time when people are closed or they're in the process of reopening. I did send out a letter as people were opening up to share a lot of the different connections and things I've learned about what I've been talking to you about, and places to go for them to learn about how to open the office effectively. A lot of them have been doing their homework, by the way, but there's a lot that have not. I've also talked to them about sharing, giving them extra PPE to get started, and fortunately, in our state, the Dental State Association has provided them with 50 masks automatically, PPE and level 3s for every dentist in our state, which is great, smart. But basically, our communication is doctor to doctor, and a lot of you have texted your doctors, have communicated with them, have seen how they're doing. I've created webinars and basically Zoom meetings with some of my doctors to find out what they're needing. It's amazing how much I'm learning from them and what they need, so that I can prepare for them to come back. And also my front office has talked to their office manager or the lady at the front that has made appointments and let them know what they're doing. Because we did open up this week, my marketing coordinator, of course, we had all these cookies that we just got from the Girl Scouts that we're going to pass out this last month. And so she went out with all those along with extra face shields for people that wanted, which we had ordered. We went in, instead of buying flowers, which are, can be expensive and don't last very long, we were able to find some beautiful flowering plants that they can use and maybe put out in front, but basically a way the flowers last longer and they're able to keep, and actually they're less expensive. But it was a way for us to go out and connect to our offices, and we usually go out to about 80 offices a month. So we do connect with a lot of people. And there is also during this time, the idea of sharing knowledge and our experiences that we're learning. I think it's great. This is where you really gain a connection with your referring doctors, and our team members getting regain their connection with these team members who have been out. And I always make myself available, and we will come in anytime, really, if they need help. And I think this is the time when you can actually expand your referral reach, because more people will be available for need your help during this time. So, and there are techniques to do that. So how do we best support our referring doctors? I think one way, of course, is all the patients they have sent, we have kept track of, and especially the ones that need crown replacement. And we send a list now that they're opening up that these are patients that we have seen from you, and this is a list of names that need crowns for those teeth, and that helps them get a good start on high productive dentistry. We help them with a PPE as a source. We advise them where to start looking. For those, last month, we recommend that they go out and start ordering them now, especially like the level 3 mask or shields, because sometimes it takes longer to get. Amazing at eBay, when I first started on looking for face shield, there's only like 2 types, and I ordered those, and now there's like about 50 different types of face shields, so they are available. But most of you work with scopes, so I think the idea of just getting those glasses, or either a goggle type glasses like people use during scuba diving, that you can actually see well, is really important. And all of you have been working, so you've probably already figured that out. But I like that idea from Michael Feldman. He's a great endodontist and is always a thinker out there, and that's some real good ideas. We share infection control changes that we've made. We show people, sometimes dentists who are opening come and watch how we go through our process and what we're doing, how we communicate with the patients. We share different clinical articles and links, and we've been doing this for the past 2 months. I've had Zoom meetings with our doctors on things that they, to get them ready. We share referral protocols and things that we need with them, like the x-rays, and how basically our schedule has changed, but we let them know that we will be available and we will get their patients in. Basically, we share how we bring our patients in, how they arrive, things like that. Office meetings can meet through our Zoom. Actually, during this whole process, when I've had, a reduced number of employees, some on complete unemployment before we're starting paying them now, is that each Monday evening, we had a Zoom meeting where we talked about issues in the office or how they're doing personally and what are their successes during this time frame. That's been really helpful in creating our relationship with our team. And that has been helpful. And you may want to continue to do that until you really have your team up to full bore, because it's fairly simple to get onto Zoom. We share with our referring doctor different training resources, such as All-Star Dental Academy, which is a great way to train their team on verbal skills. There's some really good information on Burkhart Dental and Bentco. These are some great sites that you can go to, check them out, and share. We talked about Cedar Solutions as also some great ideas and open. A lot of this stuff is free now. I mean, I belong with Cedar. I've worked with Burkhart. I'm a member of All-Star Dental Academy. I want to understand the general dentists and what they're looking for. And actually, I'm on a mastermind group with multiple general dentists to see what's important to them and what I can share with them. And then weekly uplifting information each month we support our people with. We talked about that. Teledentistry is an idea, something to look at. We'll probably talk about that later in some of the programs I'm having. We need to understand the economics, and this is kind of important. We have really, over the last month, we've definitely had a significant drop in our income. I mean, actually, we're just barely making overhead costs for majority of the endo offices out there. And we need to bring back our referrals as soon as they reopen and be available for them. We have to help them with the scarcity mindset. Now, initially, they're going to be busy and they're going to start sending more endo, but as soon as that, pinned up group of patients that they've been putting off for a while is caught up with, then and our endo off. Remember, we also have pinned up. Also, a lot of patients weren't in pain, and they may have had a lesion or whatever, but they weren't. Legally, we weren't going to be able to see them, and so we have a lot of cases out there already, and so we have to catch up with them. But there will be a lull, and this will be happening probably within a month or two. And then we really have to understand how to play the game, and what do we need to bring these people back, and how we need to modify our schedule. And it really depends on your mindset. Okay, many patients will remain nervous, and the recession will suppress patient flow, and we need to know that. We need to know how to adjust that. Recession will reduce the insurance benefits and the ability of them to come in, and price sensitivity will also affect their case acceptance. But our mindset's very important. Not business as usual in the foreseeable future. We're going to see practices' weaknesses exposed. And you've seen that when things all fall apart, who's going to be your best employee? Who's employee that really may not be important to keep in your office because they choose not to come back, or they come up and try to support you in your office? We have to look at different innovative approaches. So like I said, marketing and connecting with our referring doctors, and actually the way we do our endo to be more efficient. We have to get our team aligned to this new reality that's out there. So you have your choice. Personally, I could see back to full recovery by the end of the year. I believe there may even be an opportunity in our practice where we will actually might have a great year. I don't know if we will, get a 5 or 10% increase from over last year, but I think we could get very close if we have a mindset that that's going to happen. Some people see that be a limited recovery over the next year, and that we're going to be maybe 20% down. Some people feel this is going to go on for 2 years, and that's their mindset, and that's what they're going to get. And some people will never recover. And there will be a few offices that just don't remain open, and endodontic offices, because they don't have the guidance to keep them on path. And but how can you recover quickly in this process. Okay, here's some ideas. You have to reduce the slack time in your schedule. And I would try to do more one appointment endo. I would time yourself, and I would try to, I would stick with the patient, get a little quicker on your anesthetic. You don't have to push it. I mean, basically, I believe within 3 to 5 minutes, the patient could be completely numb, and I could easily be working just with those additional injections I mentioned. Most doctors, if they say they could do a case in an hour, they should really be timing themselves. You have to really create a design and schedule strategies for the things that you do. So improve your way you do schedule patients, maximize delegation to assistants. A lot of you in our office, they write up the records, they write up the treatment cards. Yes, we do review them, but I don't write up anything, but I do review them. We adapt to new opportunities. X-rays from referrals do help with certain cases. Dental dentistry may be one way to reduce side books, adjusting the hours temporarily available for patient-sensitive time, taking time off. When people get back to work, they won't be able to take off for dental appointments, and we may have to have more morning appointments or later evening appointments. But these are things that we'll have to kind of look up as we go along, because your general dentist needs to adjust to that also. We need to learn to tighten our systems, the way we communicate about fees and how we're able to create a relationship with the patient where we can work with them and make it affordable for them. We need to invest in marketing. I mean, most general endodontists, or 79% of the endo is really completed by general practitioners. And what is interesting about that, it really depends where you're at. In some states, in Utah, it's probably more like 90% are done by GPs. I mean, I'm in a town of 60,000. We draw from around 30,000 or 300,000 patients. I have 6 endodontists on my block and 2 other endodontists in town. Yet we're one of the most productive offices in the country because we have trained these general dentists to send most of the root canals. And that is done with different techniques, especially same-day service and those sort of things, and modifying our schedule so we're available and we can see that patient that day. That's the big thing, but that is done when you understand scheduling. There's huge opportunity actually in this recession to really make a comeback. And there's always a reason why these things happen. There is a gift in this whole process. And I want you to be available, be aware that there is a gift and be open to the possibilities. It might be you may need to change the way you're doing dentistry and running your practice. And we can help you with that. And I've got some ideas that I want to share with you over the next few months that I think would be very helpful. Most endodontists really don't know how to market effectively. And if you're going to market, this is the time. This is the time you have to create those relationships, because in a point in the next couple of months, these dentists are going to start running out of patient flow and they have to be thinking about doing their own endo. And the better relationship I have with them and the better I help them make their practice more profitable, the better our practice will be. Marketing coordinators and jobs, how we affect the top referrals or look at middle referrals and bottom referrals. That's all in marketing. Another thing I think I would highly recommend is to invest in yourself and in your team. And when you do that, you could actually go through this pandemic and survive. And that's really, you need an outside source. And we're going to offer some things here that I think will be very helpful so that you can get back. How would it really be like to be able to increase your production up 10 or 20% even during this time frame versus a reduction of 10, 20, or 30% instead? And so what we have done in EndoMaster, we've kind of put together a program, 3 different programs that help support you in your practice. One's basically a recovery planning program. So basically, we're going to put 6 seminar series together and 2 each month from June, July, and August, especially during this time when there are going to be changes. I can see a reduced referral from your doctors. So every 2 weeks on Wednesday, starting June 10th, we're going to have different things focusing on different things: team and patient recovery, get them back in shape. We'll talk about referrals and the cases we have and how to manage those, the economics of the practice. A lot of this will be involved in scheduling and things like that, how to bring back your marketing plan and your own personal economics. How can we bring back the money that we've been losing and save? By the way, just to mention, I mean, I want you to be safe with your money. Now's not the time to look at real bigger investments and try to be in cash as much as possible as you're going through this process. But I wrote my new book, basically creating personal and financial freedom for endodontists, and we'll talk about those sort of things. And then also, how do we increase our productivity during this time, and how can we grow our practice? And so this whole seminar is basically for the entire practice, and you can register. It's like $495 for this course, but it's basically, I'll be there with you. We'll be sharing answers and questions and things that you need that come up and keep you up on pace during this time. So that's one program that we're going to have. And actually at the end of the summer, we're going to put together, a program that I've normally put together is this seminar in Washington, D.C. Now, it may end up being a Zoom seminar, depend how things are. If people want to fly at that time or whatever. It's 12 credit hours. And basically, this is a time for you and your team to come together, and we go through the whole business of coaching. Now, the first program was just basically you, me, and the coaches out to get together and talk about what's happening in those in the webinar or in those 1 hour webinars. This is basically a day and a half program where we talk about central roles of the team and how they can do to better improve in the office. We show them what's possible. We show them scheduling. We do all those things, adapting to a new normal patient referral relationship on how to manage marketing. And then we give them a foundation to continue their practice growth. And that's basically, to kind of shake off this whole pandemic thing and kind of get back and hit the ground running for the new focus. But also those that just really need someone to come in. And I think most people really need someone to come in and work with them on a routine basis and work with their team to get things together. We created a modern recovery coaching. It's a very reduced rate that we give this, but it is just basically you've been working with me and a coach, and your team would have access to them. We would work with you weekly on things that you need to look at your scheduling, how to recover your income deficit during that time, ramp back up to productivity, and create a foundation to drive ongoing growth. And basically, this is supporting your practice in your systems and your strategies to help you through this process. It's really one-on-one coaching with the endodontic mastery coach, which we have 4 of them. And we also have, and I personally you have my personal cell phone number. You can call me anytime on any question that you have, whether it's clinical or, systems or employee related. This is basically over a 6-month period, and it's much lower cost than our normal coaching. And it's really an investment in your recovery and growth that will help you pay for itself really over time and probably very quickly. A lot of people, I was just working with another coaching person who signed up for our program a few months ago, I guess. And they just said that, we've been doing the same thing over and over again, but we're not making any changes. And I see that so much because someone needs to come in and look at the practice and give you the ideas and insights from multiple practices that we've worked with. And that is the key to really one-on-one coaching. And it is amazing that what the growth that this practice will have over this next year, even during this pandemic. But if you're interested in that, then we'll have you, you'll send you a link to Deborah Miller. She's the director of coaching, been a coach for many years, and she can talk about the program and the importance it can have for you and your practice. That pretty much sort of sums up the things I wanted to talk about. Do we have any questions that have come up?
We had a couple of questions just to let everybody know. Yes, we will be sending you this on Friday. We'll have a follow-up email and everything that Ace has shared, included the recorded link. But if you have any other questions, specifically now to ask Ace, you're more than welcome. Please type in the Q&A. And then if you have personal questions that you want to connect with somebody personally to address something that's going on just for you in your practice, then Deborah Miller is a wonderful asset for that.
Yeah, she's been actually coaching. She was our head coach. She has been our head coach, and she's been coaching for multiple years with many different companies. And I'm glad we have her with us. Is there any other questions that people have typed in at all?
We don't. So I'll just, as people are thinking about if they have any questions to ask, I wanted to just let everybody know again, we have a follow-up letter, and we will be updating our website by Friday, and you're going to get all the links to this recorded webinar and to the and all of the downloaded resources. And then you're also going to get more information if you're interested in supporting yourself with the recovery options. And if you do know now that you want to join our webinar series, you can go to our webpage, attend a seminar at our endomastery.com website, and you can sign up. And then if you're interested and you don't want to wait and you want individual attention, you can also talk to Deborah. So
Okay.
now I'll just swing back around and see.
Now, if someone raises their hand, does that mean they could speak?
No. And it looks like they put their hand back down. Oh, here's a, Dr. Jim Gearing is saying, hello, Ace, it's great to see you. Thank you for helping us to get back to work. I actually know you too, Dr. Gearing. It's nice to thank you for your kind comments.
Oh, that's great. That's good.
Let's see. I think I don't see any other questions. So I think we are good. Do you want to close this out, Ace? Thank you, Ace, for your commitment, and thank you to all the participants for being on.
Well, I'd like to really thank everyone for attending the meeting. I just had these ideas that I wanted to share with you. Some of the things I've worked with our mastery circle and our coaching things that people that I've worked with that just seem to be important and questions that they've had. And these are some ideas, of course, they've shared with us. We've incorporated in our practice, and it's been really helpful. And getting back has been actually fairly smooth. And I know a lot of you endodontists out there have already gotten back to practice and are wondering about some of the things we talked about. But I see the next year, I'm more of pretty much of an optimist. And I always see that the 75 years I've been around, I've learned that every trauma in my life that has come, there's always a great gift hidden behind it. So we need to really look for that gift. And I think over this next year, if you look for the gift, it will appear. And I want to, again, welcome you to join into the things that we're going to be coming up in the next year. And I think we'll have a great time together. All right. Once you get back, enjoy your practice, enjoy your team and your referrals and your family. Okay. Have a great year. Thank you.